Thank you very much, Timothy, and to everybody that's on the call. Good morning, good evening, good afternoon, depending on where you're dialing in from. Glad to have this opportunity to just share some insights around careers in Africa. What we want to cover this afternoon is just really tackle how we see the landscape of healthcare evolving in East Africa. So just shed some light on, what we're seeing on this part of the world. Also look at what the emerging opportunities are for employment, but with a particular focus in East Africa. But I know some of the principles that we'll share cut across the continent. Understanding what employers seek in healthcare talent. And then we will also share tips on how to successfully navigate the transition back home. One of the things Timothy didn't share is that Ruth and I are both returning graduates. So I'm a returning graduate from Canada, and Ruth is a returning graduate from the United Kingdom. And so we wanted this to be as practical as possible. So we'll spend some time just sharing on how did we transition, how did we get into employment, what were the lessons, and so forth. So in preparation for this webinar, we engaged with quite a number of employers, as well as recent graduates in Ethiopia, Kenya, as well as Rwanda, and we called it the Employer and Graduate Insights Initiative. What this has helped us to do is, number one, just get a real pulse of the challenges and opportunities in the health sector job market. Get a sense of what employers are expecting. So what are the in-demand roles and in-demand skill sets? But also gather, practical job-seeking tips. And we tapped into quite a number of recent graduates just to get their insights as to how did they actually secure opportunities in this evolving landscape. One of the things that we are struck by is just how dynamic the healthcare ecosystem is. And I think this dynamism then presents quite a number of varied opportunities. So from your hospitals, from higher education institutions, to not-for-profits, to the big innovative healthcare space with startups, research. I think that this gives us just a broad playing field in terms of the emerging opportunities. So if we just look at this first from a big picture perspective, what does the healthcare landscape actually look like in East Africa? I think the word that was used to describe it over and over is that, and I'm sure this phrase is familiar to quite a number of you, is we're living in VUCA times. It's volatile, there's uncertainty, it's highly competitive, and also extremely ambiguous. And the healthcare sector is no exception to this. What we are seeing is that it's an industry that is changing quickly and being shaped by technological innovations, but as well as socioeconomic factors, which creates both challenges, but also opportunities. So what are the key challenges that we say we've found as we've spoken to those employers in that ecosystem? One of the things that has emerged is just the challenges of infrastructure, healthcare infrastructure in East Africa. Specifically, the healthcare systems are underfunded. And so there are challenges around constraints in budget, limited equipment, and also just limited personnel. There's a very real challenge around limited access to quality healthcare, particularly in remote and underserved communities. Stories of communities needing to access healthcare miles, walking kilometers to access the nearest clinic. Our systems are also overburdened. So high patient to doctor ratio, overworked, underpaid staff, long queues, long waiting times. So infrastructure presents still a very real challenge in the sector. Brain drain. Skilled personnel are migrating to developed markets in the US, Europe, Asia, and so forth. So the brain drain is real. And so there is a shortage of skilled professionals. So not enough personnel per capita. There are limited training opportunities. So it was cited that the limitation in just enhancing one's knowledge, being on top of emerging technology and so forth. Access to healthcare, over-reliance on donor funding. I think what we're seeing currently in East Africa is a bit of vulnerability. We've seen programs being shut, as there shifts in donor priorities, so programs being shut, creating a very real vulnerability with that dependence on donor funding for health programs. Policy shifts. I know the policy shifts in Kenya are not the only, we're not the only country experiencing an evolution of our national priorities around healthcare. That has its challenges in terms of implementation and just going through those teething issues. It is a very real fact that accessing quality medical care is expensive. So there is a high cost of just accessing quality medical care. Other challenges that emerged through our discussions was technology, slow adoption to tech and digital health tools. Our health information systems are weak, inadequate. The very real challenge of unreliable internet and electricity. We've had our fingers crossed that it doesn't rain, because when the rain comes, the electricity and the internet go. So keep your fingers crossed that the rain holds for the next hour. Healthcare workers lack skills and confidence to use new technologies. There's funding constraints to scale technology. And there's a very real drain on tech developers with a health focus. I hope I'm not presenting a doom and gloom picture. There is hope. So I'm on my last slide on challenges, but it's important that we remain cognizant of these issues, even as we look for securing opportunities. Social challenges. I guess with the advent of social media and access to information also comes the spread of health misinformation and the very real challenge of poverty and cultural issues affecting the uptake of health services. I'm sure you've read and seen that there's still a high rate of unemployment of doctors for various reasons. In fact, we did a quick survey, and what you're seeing on your screen is the current doctor-to-patient ratio in Kenya, in Rwanda, as well as Ethiopia, against the WHO recommended patient ratio. So again, very real challenges that the sector is facing. Allow me then now to shift my focus to the opportunities, because where there's challenge, there is then opportunity that can be capitalized for further innovation, impact, as well as investment. So some of the opportunities that we are seeing is tech and innovation present a very real opportunity. So everything from telemedicine. We know one children's hospital that's currently running, for example, telemedicine for clinical examinations. The opportunity that AI is presenting in terms of supporting disease detection as well as diagnosis. The robotics enhancing manufacturing, drug manufacturing. So there is opportunity around tech to, say, enhance the sector. Language processing tools, as well as what we're seeing, just the rise of health tech startups addressing local challenges, but with locally tailored solutions. There was a recent summit, even just here in Nairobi, and we're just amazed at the number of tech startups and the type of solutions that are being rolled out in the market. Other opportunities, we are seeing a return of specialists, and that is boosting our talent pools and just growing workforce. but also presenting knowledge sharing opportunities. And those partnerships I know are going a long way in terms of mentorship and just growing the capability of our local talent. Climate and environmental issues, again, a very real opportunity that can be capitalized. The creation of climate-resistant systems, WASH services to prevent disease outbreaks, leveraging clean energy, biogas, and that whole discussion. And well, it's just looking at programs that support just that health, environmental sustainability conversation. So hoping that, as much as, yes, there are things that are not working, there's a whole host of opportunities around the ecosystem that can be capitalized. There's a growing interest in Africa-led research, and we're seeing more and more collaborations with academic institutions, government, pharmaceutical organizations, the private sector. Infrastructure, lots of private-public partnerships with modernizing hospitals and facilities, investments in equipment, and so forth. So with that in mind, how do you, living internationally, navigate this landscape? So we asked the employers, what are they looking for in terms of their healthcare talent? And I think what has emerged very clearly is, number one, employers are looking for professionals who understand healthcare trends, understand where healthcare is moving to, and can add value to help their organizations adapt to that landscape. And so what we asked employers as part of this webinar was, what are those in-demand roles? What are those hard-to-fill roles? And where are the talent pools? Are they looking in local talent pools or international talent pools? What about the emerging roles? What do they see as the roles of the future in the next 3 years and 5 years and so forth? And so we hope that these insights will help you as, even if you are considering advancing your healthcare career on the continent. So what you're seeing on your screen is what we gathered were the in-demand roles. Top of the list was clinical and specialized roles. The specialist roles that were mentioned were areas around cardiology, oncology, neuroscience. Specialist nurses, again, around those areas. Medical officers, but with a focus in remote areas. Chief medical and information officer, so the marriage between tech and the clinical space. So how do you leverage technology around the healthcare and the medical aspects? The area that came up repeatedly was digital health specialists. So from your analysts to your visualization specialists to quite a host of roles which we'll share. Laboratory roles, the example shared was biomedical engineers, resource mobilization specialists. This we found interesting, and it's obviously driven by the shift in donor funding and donor priority. So individuals who can mobilize resources towards healthcare programs or healthcare initiatives. Public health specialist was also mentioned as an in-demand role. And the other area we have not put, but I think also needs to be mentioned, is the whole aspect of research and development. We shared earlier around the growing interest in Africa-led research. And so again, just speaks to, again, this being an in-demand role. We also asked employers what the in-demand skill sets are. What do they see as those in-demand skill sets? And top of the list was digital and data skills. So some of the examples given was health data analysis, visualization, health informatics, cybersecurity, data privacy. Other in-demand skill sets was that patient-focused care. So for the clinical and specialist care, it's really around how to be patient-focused in the delivery of the care. Other in-demand skill sets was public health, particularly disease surveillance, leadership and people management, a critical skill, as well as soft skills. And I think the skills that were emphasized were skills around being empathetic, being adaptable and flexible. Things are changing. Being innovative, communication, as well as teamwork. We will share these slides, and so you will have this information, but this is just to give you a sense of what organizations are looking for in terms of those in-demand roles, as well as in-demand skill sets, and that hopefully will help with positioning. We also asked these employers how they source for healthcare talent, and this is what they had to say. Job boards. Local as well as international job boards were a source, and social media, universities and health science colleges, professional networks, alumni associations, communities of practice, government-sponsored programs, NGO-sponsored programs, as well as recruitment agencies. As I transition to hand over the presentation to Ruth, she'll walk you through some of the job boards that have been mentioned as sort of being key sources of, shall I say, scouting, but we'll also share other avenues that you can consider. So this is just to give you a snapshot of where employers are looking for those in-demand roles. So as I transition now to Ruth, we have a question, and I don't know if the chat is working, but even if it isn't, it would be great just to hear or to understand what is your biggest challenge right now in advancing your healthcare career? Timothy, I don't know if the chat is working. This will be a good time to test if it is. But what's your biggest challenge right now in advancing your healthcare career? Ruth, and over to you, even as we hope we can get some feedback on that question, or maybe not.
No worries. If you can, maybe try the Q&A function, because you'll be able to see that. So if you type in your answer to that
Ruth,
question.
we can't hear you.
I hope you can hear me now.
Yes, we can hear you,
We
Ruth.
still can't hear.
Yeah, I think Nyawera's audio may not be working, so Kinoti, if you could prompt her, but Ruth, please go ahead, we can hear you.
Thank you so much. So yes, again, the question is, what are the challenges that you are facing or might be facing in advancing your healthcare career? If you have access to the Q&A function, feel free to add on there the answers, and we can try and highlight a few. I'll give a few minutes for that as I pick up the rest of the conversation. All right. So what we can do is maybe try and highlight some of those responses towards the end in terms of the challenges that you individually face when it comes to advancing your healthcare career. As Nyawera mentioned, I will be sharing from the perspective of the scholar or from the returnee. As Nyawera said as well, I am a recent returnee. So I studied a master's program in the UK and relocated back to Kenya, which is my home country, October of last year. So this whole process of coming back, looking for work, navigating the ecosystem back home is very relevant for myself. And hopefully these insights will be practical and meaningful for yourself. So we spoke with various professionals. So in addition to speaking to employers, we also took the time to speak to various professionals who have experienced studying abroad in Canada, across the US, and in the UK, and have returned to work in East Africa. we looked to understand from them what motivated their return, how they went about searching for job opportunities, and then the different adjustments that they made entering the local workforce or transitioning into local cultures. So the decision to return home was motivated by several factors. The most prominent is looking to reconnect with family, missing home, so just the desire to return back to family. Then also a strong passion to contribute locally. Some of the challenges that we shared earlier were key on the minds of returnees looking to make an impact back home. And then also more realistically, financial factors, immigration factors that influenced the decision to move back home. And in that transition back home, there was a matter of searching for their first role after graduation. And for some people, it took as little as 4 months. For others, up to 1.5 years. I think mine was probably 8 months. But really, the search for work can really take some time. For some, it's sudden, it's really immediate. But for others, it can take a long while. And this is due to several challenges that some of the graduates identified. First, the job market is incredibly competitive. We mentioned some of the unemployment issues that are faced in East Africa. But essentially, when somebody is going to apply for a job, there's often a high number of applicants for each vacancy. Another key issue that graduates faced was not receiving any feedback whenever they make a job application. So not hearing back from hiring managers, not hearing back from employers. And then just the idea of a fair hiring process. There's a lot of work that goes into submitting a job application. And oftentimes you find that a successful candidate is maybe found through other means. So just the question of the fairness of these hiring processes. And in some instances, seeking support when it comes to employability and getting like CV writing help can often be quite costly. So that is another challenge that people have faced. And then, as I mentioned, the application process can be quite tedious, even for an entry-level role. You might find there's an online application, then a written assignment, a psychometric test, maybe a few different interviews. And you might find that graduates would go through this whole process and in the end, unfortunately, not be successful. So these are a few of the challenges that have been discussed. But just as Nyawera did, I'm not here only to highlight the challenges that are faced, but also to provide practical advice and tips that have worked for graduates, has worked for myself on finding job opportunities. So first, the most important, networking, building connections through various channels, and we have a few here. One, attending workshops, attending career fairs, joining communities of practice, which is essentially groups of people that are looking to solve problems in your field. So I think we had earlier some health policy and communications professionals, public health professionals. So looking for those groups that are in your field and building connections within those groups. Also using LinkedIn, I think as one of the graduates put it, LinkedIn is your best friend. And as a recruiter myself, I would say LinkedIn is your best friend. But then also other job portals, which we will highlight as well. And then just generally social media. Then secondly, we also would recommend engaging in mentorship and leadership programs as well. So whether it's programs for young professionals, programs for career development, programs for leadership development, programs where they would connect you to a mentor, we would recommend joining those. And then looking for those online forums, again, that are specific to your field, or just forums of job seekers, communities of professionals that you can engage with, that you can get advice and support and hear about things happening in the fields that you are looking to work in. In some instances, there are specialized platforms. So let's say you have built maybe some of those digital skills, looking for platforms like GitHub that you can engage with and share content as just a specialized and niche platform. And then the last recommendation is directly engaging with employers. So while some employers are not always actively recruiting for vacancies, it does help to engage with some of these target organizations, introduce yourself to their talent teams, and stay connected so that when they do have a vacancy, you are either within their internal talent pool, or you are just informed. Whether you follow them on LinkedIn, you'll be notified once they do share the vacancies that they have. As well, a lot of organizations use recruitment agencies, as we saw earlier. So again, connecting with them, introducing yourselves to them, sharing your CV and profile on their database. Lastly, volunteering is another key way of securing a job opportunity. Some graduates found this as a useful tool as they were searching for jobs to also work part-time or volunteer in their area of interest. So as I mentioned, we would love to share the job portals that have been recommended by returnees. We have platforms like DevX, Impact Pool, Relief Web that are really keen for developmental health or development health organizations and nonprofits. Move Me Back is a really good resource for people who have studied abroad and are looking to come back to the continent. They also, I think, have a good network. They have regular events. There are also local opportunities. So in Ethiopia, local portals in Rwanda, and then in Kenya as well. The clinical staff application is a government program in Rwanda that shares public sector vacancies in health or by the Ministry of Health. So within each country, there are several different portals to use. And again, it's a matter of, there might not be a vacancy that's directly in line with what you're looking for currently, but being active on these portals, sharing your profile and CV would really help so that when those vacancies become available, you can be the first to apply to them. Then another thing that was mentioned is attending networking events. So attending conferences, attending expos and summits. And we've put together a few, not an exhaustive list at all, but a couple of different conferences and health events that are happening, some locally in East Africa, some just across the continent. But a lot of these conferences you find have as well virtual sessions that they run. So for example, Nyawera mentioned the Nation Health Summit that took place, I believe it was last week. They streamed the entire summit virtually. So if you're still studying, or we saw a few people that are tuning in from all over the world, some of these conferences, you can attend them virtually, connect, even if it's sending a LinkedIn message to the speakers after the events and just sharing and connecting with them. But yes, there are quite a few happening throughout this year, and you'll find that a lot of them are annual summits. So if you missed it this year, you can as well catch up the following year. And then we also mentioned some of the professional associations, and we would like to highlight some of them. In Rwanda, there's the Africa Healthcare Network and the Global Health Network. We also have a few in Ethiopia, from associations of nurses to health forums. And then here's a few, again, not an exhaustive list. There is plenty of different boards, whether you're a public health professional or a counselor, there's many different groups and associations. And often you find these boards consist of organizations, so organizations that work in these areas, as well as individuals. They have frequent events and conferences. So looking to connect with people in these associations and groups. And now moving from that, we've shared a few resources, but essentially this is also just to provide some guidance on the transition back home. So we wanted to highlight what the adjustments that returnees had to make, especially culturally, when moving back home. So the key challenge that they faced is really reintegrating into the local culture. And the point of advice that they had was really keeping an open and positive mindset. When you're working in new environments, the workplace is a very different environment from an academic background. It's really important to maintain that open and positive mindset. And then also when you're in the workplace or you're working with a health employer, you need to learn how to engage with different stakeholders. So whether it's a patient to a member of a community, or whether it's a donor or your manager, really learning to adapt to your communication, learning to adapt your approach when engaging with different stakeholders is a piece of advice that the returnees provided. And throughout all of that, the main support factors that returnees felt really helped to them, one is peer support. So having a network of peers that are also facing a similar transition, if you're currently studying, having that network of students that are also facing that transition back home. And also mentorship. It is a key way of finding support. If you can find a mentor, somebody in your field that has gone through that transition or that has found a job, maybe in an organization that you want to work with, relying on those support factors are really key to guide, is really key to guide your transition back home. Then we also have further advice to share from the returnees, as well as from our own perspective at CEDA. So first, I'd like to share a quote from one of the graduates that really summarizes the advice. So they said that your earnings and your lack of support from the government can be a point of frustration. As we saw, the challenges in the healthcare sector are many, but your driving force should be your passion for health, which should be your desire to make an impact. So a few general tips for returning professionals. One, start early. If you're looking to relocate back home, try as much as you can to secure or to start the process of securing a job before you do relocate home. Second, build your personal brand. So whether you're joining groups, you're joining professional platforms, when you're on there, share the work that you're doing. If you're doing some research, if you have published a study, share that work and really demonstrate thought leadership. And thought leadership doesn't mean that you are suddenly an expert in public health and you are sharing from a really strong point of expertise, but really that you've learned something new, share it within your network. You attended a networking event and somebody had some really insightful notes to share, just repost those thoughts, and through that you're really engaging in thought leadership. And stay active. Don't post once in a while. Engage with your community, whether it's on LinkedIn, whether it's through the networking events that you attend. And then, as previously mentioned, seek experience through volunteer roles, through fellowship programs and internship programs in areas that align with your interest. And overall, what we saw as a recurring point of advice is to adopt a growth mindset. So as you're looking for work, even if you're studying, continuously enhance your skills. If it's in data analysis or other digital health skills, like those that were identified earlier, look for ways that you can enhance, whether it's through an online course, obtaining a certificate in a certain area, continuously upskill yourself. And then if you're still studying, or if you're an alumni, leverage your career center. They are still available for you. Book sessions with the staff members there and get support from the career team. And as mentioned before, but we will say it again, connect with people in your field and grow your professional network. And an idea that one of the returnees shared, if you are back home, set up coffee chats with, if you're connecting with a professional that you'd like to learn more from, ask them if they have 30 minutes, invite them for coffee, or even if it's virtually, invite them for a short call, and really ask them for informal advice, and ask them for insights, and really pick their brain over those 30 minutes. And then attend networking events. Networking events really worked for myself. I remember attending a professionals cocktail and meeting a director that eventually became my employer for a former job that I was in. So don't be afraid to attend them, introduce yourself, talk about the area that you're looking to work in. And then finally, we have a few more tips. Understand the industry. As we shared before, the various challenges and trends. It would help to position yourself as somebody who has solutions or just has a strong awareness of the trends in the healthcare sector. And then as you're making applications, I know very well how many applications and jobs that you apply for. For each of them, if you can, tailor your CV and your application documents to make them relevant to each role. So every time you submit an application, make sure to use those keywords because they really are used when employers and recruiters are reviewing applications. So make sure to tailor your application each time you apply. And then finally, re-highlighting the growth mindset. There will be many rejections. It is important that every time that you're unsuccessful in a job application, that if you can, ask for feedback, but really to reflect after every interview, how can you improve? Every time you tailor your CV, you are making it better. So really learn from the tedious application process. And remember that you will find a job down the line.